Welcome back to Midday Kentucky, everyone. We are here with Gina Johnson-Higgins. She's a dentist here in Lexington. Thank you for joining us on the show again.
My pleasure to be here.
Now, we are going to be talking about children's dentistry, and this is really important because I know when I was a new mom, I really didn't know when to really bring the kids in and when to start having them see a dentist. So thank you for being here. When is a good time for parents to start bringing children in to see a dentist?
The American Academy of Pediatricians recommends that your child be seen by a dentist as soon as there are teeth, or within the first year if the teeth have not erupted.
Okay.
So if your child was born with a tooth, which can happen, then you would want an almost immediate visit. Somewhere within the first year is typical, though.
Okay.
Yeah.
And there's a mandate before kids start school, right? We know school's coming
Yes.
up. Talk to us about that.
Well, one of the problems we've discovered with children struggling in school has been toothaches and unforeseen dental complications that distract them because they're just baby teeth and a lot of people weren't paying attention to them. So our legislators put a law in place that said you needed a dental exam before you could begin school. So by December, children entering kindergarten in Kentucky need to see a dental practitioner, a dentist, and have an exam. And there's a form. It's typically part of a welcome packet from the school, or most dentists will have that form in their office. And it just lets you get an assessment so that you can see what's happening inside your child's mouth. For a lot of parents, if routine dental care during childhood was not part of their experience, then they haven't started that for their children.
For their own.
Yeah.
And so, and you had mentioned the baby teeth. There are only, a lot of parents think, oh, it's just baby teeth, you know, it's not that big of a deal. But we were talking on the break, and you're like, no, it is a very big deal.
Primary teeth, or baby teeth, as everyone calls them, are critically important to the development of your child's speech patterns. It's how they eat. You know, this is how we communicate. The mouth is truly the gateway to the person because all of your health can be mirrored there. And here's if you're worried about, you know, braces for your child, the cost of orthodontics, losing the baby teeth too soon can ensure that you need long and costly orthodontic treatment.
So it's good to get in there
Yeah,
early.
so you
and I know
wanna
you said
keep them.
monitoring the progress there. Why is it so important at a young age to have some of those X-rays that you perform?
Well, X-rays show you the areas between the teeth.
Okay.
Children as young as, you know, 1 or 2 can have teeth that are being eaten alive by the bacteria. They have cavities in their teeth that become abscessed and painful. So there's not a set time for small children to have X-rays, but your dental practitioner can see if there is a need.
Right, right. And,
Yes.
and it also, it gives you all a heads up too that if there is future dental orthodontics that need to be done with that child, you can kind of catch that early and kind of prepare the parents for that in advance, correct?
And for some children, not all, but for some children, orthodontics is now done in 2 stages by an orthodontist. So you move the teeth so that the face can grow properly while the teeth are growing, instead of waiting till everything is so difficult to move.
I love that, and that's how you said that's more cost effective.
It's more cost effective, and you get better results.
Okay.
And you have much less miserable teenagers. So it makes a huge difference for the children. But a lot of parents think, oh, the orthodontist just wants to charge me twice. But it is truly the very best thing for your children.
Wonderful. Now, how often should children come in for checkups? How often should this be happening?
I, in my practice, recommend that after children have gotten more than the 4 front teeth, that we see them every 6 months.
Okay.
Okay? Because cavities can happen. Cavities happen to good people every day, okay?
They do.
No, but the moms take it hard. They
Okay.
take it as a personal,
But it still
you know,
happens. All right.
my child, you know, my baby, my child. But these things do happen, and we want to catch them early.
Absolutely.
Well, Dr. Gina Johnson-Higgins, thank you so much for coming in. We
It's my
appreciate all the
pleasure.
advice. All of her information is there up on the screen. Make an appointment. It's mandated. Get your kids in there.
Yes.
We appreciate it.
And we'll be right back right after this. We're going to be talking with Winchester Chiropractic, and we're going to be talking about new Kentucky law about sports physicals. So keep it right here.